first of our dinner conversations. We have our founder's story with Shaye, Mandle, and Jon Pearce from Zipnosis.
And by the way, in that Device Talks board game, you win by getting to Medical Alley, Minnesota.
Oh.
Welcome, everybody. It's always great to have Brian, the Device Talks team. This is a great event. We've been doing it for a few years now. And I think we continue to have incredible content, incredible people. I got the lucky opportunity to do the founder's story tonight, and I'm really excited to have Jon Pearce here. And I think a lot of you, especially folks in this community, certainly know Jon and what he's up to. For some of the attendees who've come in from around the country, I think this is one of the more interesting founder stories, and also one that really, I think, should be giving everybody some insight into where we're all headed. So with that, I'd like to start. Jon, there's probably too many people here that don't know you well or Zipnosis, so give everybody a little overview of your company and you and why you're here tonight.
Well, thanks everybody for being here. I always appreciate the opportunity to get in and tell the story of Zip, and I hope you find my candor to be part of my, giving back. I've been the recipient of a lot of people who have invested a lot in Zipnosis as a company and in myself personally, and I always think it's important to kind of share the stories along the way. So I look forward to the conversation here tonight. So Zipnosis as a business, we provide virtual care as a platform to healthcare systems. And so what it means is that we provide all the infrastructure for them to rapidly sort of launch and then integrate and then scale a branded service using their clinicians, their resources, to be able to diagnose and treat patients outside of the traditional care setting. And it's a very different way of looking at it than sort of traditional telemedicine, and we can kind of get into some of the specifics there. But really, we've been transforming how and where patients and providers connect for care. And now we're taking that model and we're proliferating it across the United States. And then I think what you'll see, and happy to kind of talk about what I see coming next, but the next transition will be to take that very powerful platform and start to think about and reshape who pays for healthcare along the way. So that's where we're at. We're here, we're based in Minnesota. We're a little over 40 people. We started last year at 9. We just raised a Series A of about $17 million in January. It was our first significant funding, and have all the pain and none of the hair left for all the bootstrapping that we did through the years. Anyway, I'm excited to share the story.
Well, and may have been at 9 employees last year, but Zipnosis was actually co-founded by Jon in 2008. So in 2008, you had no experience founding a company as a chief executive, even in healthcare, really.
Right.
So take everybody through, sort of the heart and mind of how you launched Zipnosis, and maybe more importantly, why, and what should entrepreneurs or budding entrepreneurs take away from your story as they look to take the plunge.
Well, hopefully you don't have to struggle as long. I think that's the first thing. I think for me, a lot of it was built around conviction. So I'm sort of a visionary thinker, and I've embraced that role. It means I see things down the road. It also means that I don't see usually what's in front of me, and so I kind of stumble over myself. And I'm lucky to be wearing pants today, but I think I kind of understand where things are going. But for me, it was very clear that healthcare was making a transformation. So I was in another healthcare startup called Provation Medical, and we did clinical documentation, and it was a fantastic experience for me. I sort of got to be a part of an early stage startup all the way through exit. And I got to be in the operating room, I got to see the billing, I got to actually work with physicians and the technology. And what I saw was this it sort of change from the hospital-based method into ambulatory care, and then finally into Minute Clinic, which was starting here in Minnesota. But there were a series of events that was pushing healthcare into the right size setting. And it was just very clear to me that the cell phone, the mobile phone, was going to be that next sort of platform that we needed to develop for. And so after I exited Provation, I went and sort of used business school as an excuse to basically research. And so I spent a lot of time researching telemedicine, talking to all the big players and thinking like, why isn't this taken off, right? And it really came down to two things. It was reimbursement, which is how do you get paid, and then the technology that went with it. And I kind of looked at it and I said, those feel like kind of excuses for this. and said, what if we thought of it in a different way? What if we said, listen, let's just assume that data and devices are going to drive this transaction. And let's put the marker out there to say that we have to fundamentally change the economics or the transaction between a patient and a provider. And that started me on a very different path than what you see today. What we think of telemedicine as sort of a video-based encounter. So Zipnosis is really built around sort of taking a very intelligent expert system, sort of quasi-AI, and I'm clear that clinicians still make a diagnosis on our system, but we're using really sophisticated technology. And all of these clinical guidelines that we've spent billions of dollars developing outside of a technology setting and saying, let's put those two together. Let's put it on a consumer-grade device, an iPhone, an iPad, whatever, and really start to unlock a lot of amazing potential and efficiency for the providers and also convenience for patients. And so that was kind of the journey. And once I started to talk a little bit about that, and it kind of started out as a Minute Clinic on the iPhone, we started to get some interesting sort of traction in the marketplace, and that was kind of the start. But for me, I spent hours and hours and hours going through models, economic models, and I knew if we could get the transaction down to 2 to 3 to 4 minutes for a provider, we could cover a tremendous amount of healthcare at a high degree of quality. And for me, that was a conviction that kind of led me through a lot of the times that just were pretty lean for us. Yeah. And I think, if I have advice for anybody who's silly enough to think about, taking this, I say silly, it's a very noble quest, right? It's know thyself. And I think that's something that I've learned a lot as an entrepreneur. And I think as you guys consider your way of innovating and being a change in the world is know who you are, know you're not going to do it alone, and say, here's the things that I do well, and here's where I need to partner. And together we can actually come together and create something really powerful. And so I think that's been one of the big lessons for me.
So in 2008, you just said, know thyself. Clearly, Zipnosis is making a huge impact today. Was 2008 too early for the concept, the technology, and maybe more to the personal side? Did you know yourself in 2008 in the way that you think maybe somebody should if they're going to embark on this journey?
So I'll answer that in two parts. So for 2008, I think 2008 was actually a really good year for us. It totally sucked on so many levels because there was no money, you couldn't raise any money, and ACA had locked everything up, and so it was just an awful time to be in healthcare. But I'm sort of a real classic economics guy, and I think you put it under that pressure cooker, and it weeds out sort of the weak ones, to be honest with you. And and certainly there was Zipnosis as a business had to mature. We had to make this pivot away from being a direct-to-consumer Minute Clinic on the iPhone into something that was more sustainable. And that's where we are today as a platform, as a SaaS company. And that was really ahead of its time because we felt the pain, right? So one of the other lessons I've learned as an entrepreneur is the role of constraints. And give me a second to kind of explain that. So in 2008, 2009, 2010, we had a massive constraint on money. We had no money, right? But I didn't really have clients, and I didn't have a precedence that was out there. So it meant that I could innovate around my business model, but I didn't have a lot of money behind it. Now, fast forward to today, we have a lot of money in our bank, but I have expectations around investor return and a business that we're actually building. And so I think it's interesting as an entrepreneur to look at not the things that you don't have, but to see constraints as where you have to innovate around. And for us, that innovation had to be on the business model. The core platform worked. Those core hypotheses that I made as an entrepreneur are actually coming true, but we weren't making money. And so for that, it was an absolute, 2008 was a really, really good time for us to make that shift. And now we're better poised than anybody else in the market to take advantage of the shift to platform and then also population health. And I think, as a person, I don't ever know myself. I don't know if it's the same for you. I assume you guys are the same way, but every day for me, you wake up and it's a journey and it's an opportunity. And I don't look back in those times and, shake my finger at the Jon Pearce event, but it's certainly been an amazing ride. And I feel very blessed to be surrounded by a lot of really good people who, helped along the way. Yeah.
So you started to touch a little bit on, so in 2008, we have iPhones, but early models. We don't really have the iPad.
Right.
Nobody else is making tablets. It's, sort of just before recession and the beginning of the conversation about what has ultimately taken us from, through Obamacare, value medicine, value-based medicine, digital health revolution, big data. All those things have happened since you started the company. So you talked about being able to sort of see forward in the future. But as a first-time CEO with a vision, and then seeing many aspects of that vision realized, but also challenges that you couldn't have foreseen, how did you kind of simultaneously both develop as a CEO, as a founder, to move a company forward, but also continue to innovate around not just your vision of the business, but how healthcare was changing in a way to put you in a position to be successful today?
I think for me it was focus, and focus and conviction, kind of going back to the core. So if we did our original pilot testing at my alma mater, St. Olaf College, and we just used the student center because it was really nice and easy there. And if we had gone through that testing and it was very clear, like, oh, we're killing patients or we can't get the efficiency that we want, I would have stopped, right? But it always worked. It always worked at a particular scale. And so I think there was that continued conviction around it. But I think focus is really, really important. And that means just being super clear on what matters and what doesn't. And when you don't have money, you have to be very clear about where you spend every dollar, right? It's obvious. But it's a discipline, and it's hard. It's hard to look at your engineering team and say, I don't have the money and the resources to do this today, but we still have to figure out how we do it. And I think that kind of focus really helped us get through some very lean times. And it's also important to understand what you can change and what you can't change. I remember sitting there, and we had Park Nicollet was one of our our local health system for those of you that aren't in Minnesota. But so they're over sort of on the west side of town. And they were our first customer, and things were going swimmingly with them. It was really going well. We were signed up for a multi-year strategic partnership, and then they basically, ready to sign, like I've got paper in front of me, going to sign this document with these guys. And they basically say, yeah, John, we can't do that. And you're like, what? Like, you gotta be kidding me. And we kind of had everything queued up around that. They had investors built around that story, and they just walked. And I remember going to bar in Uptown, the Independent, with our chief medical officer, Becky, at the time, and it was just like Jameson after Jameson, and like, we don't get it, like, what's going on? And we come to learn about a month later that they had been acquired by Health Partners, which is another system in town, which had a competing product of ours. And so, there are those things that you can't ignore. And so, do you fold in? Do you throw in the towel at that point? Everything else had been working really well. And that was one of those moments where I was like, no, we're not done yet. And so I think that focus and understanding and then that conviction kind of helped us get through it. And Shaye, you'd mentioned sort of interesting in our previous conversations, there's the entrepreneur, right, and what we've done with Zipnosis, but we've also kind of been defining the market as we go too. And I think that's also a very interesting and different dynamic for Zipnosis. And it creates a different environment where as you're defining an environment, you just have to understand there are different headwinds that go with it. Along the way. So that's a little bit of a ramble, but yeah.
So I was going to ask you the kind of obligatory fundraising question, but I think I'm actually, and I think everybody else is more interested, a little follow-up on that. So in many ways, you are setting a new marketplace. A lot of big companies working on its systems, you're partnering with some, there's competitive systems and products. Do you feel pressure to set the market correctly? When you're moving the business forward, are you just focused on the business, or are you thinking about something bigger in terms of the impact that you and Zipnosis can truly have on the way we look at healthcare?
I guess not to sound, I hope this doesn't sound arrogant, but I just consider myself a steward for change. I mean, I think there's a lot of opportunity out there, and I think that Zipnosis and what we're doing and creating that intersection between technology and care delivery, there's going to be a lot of opportunity built on that. And there are others that will do it better than we will, right? And I think, so for me, it's can we really be the force as a CEO of this company? I want to be the player. I want to be the market leader and recognized for that, not just here in the United States, but globally, right? Those are ambitions that we have. But I think the reality is that this is a really big market, and I hope that we have an opportunity to just start shifting the mindset away from traditional ways of thinking about care delivery and traditional ways of thinking about who pays for healthcare. So for me, I think the success factor will see more of an ecosystem grow, and you'll see the Me Too's kind of pop up, and yeah, you have to deal with them, and you have to deal with the big fish, the Optums of the world, and that you just got to pay attention to. But I ultimately believe that really good companies run in a good fashion in a massive market have a really strong position especially in the turbulent market that is telemedicine today. And we're one of those. I mean, we were profitable in 2014. We ran it to a point where we knew we had a sustainable business, and then it was time to go and raise the risk capital to do that.
I think one of the fun things we see about companies like yours that are setting the market is we struggle with some common definition around terms that all of us use regularly. What is value-based medicine? What is digital health? What is health IT? I think at least the one thing that's really consistent is that we've got a lot of convergence, both around technologies, but also business models happening.
Yeah.
And for you, I think you're sort of setting the standard for that, and you're here in Minnesota. So, how has Zipnosis growing up here? Has it been beneficial being here? Has it been a struggle for dollars or easier? And what do you think the value is of being in Minnesota as it relates to those convergencies that are hopefully driving healthcare?
Yeah, I don't think there's a better market for that convergence, to be honest with you, and that's one of the reasons why we're here. I mean, when you look at so we have a lot of MinuteClinic DNA on our team, and I think that in and of itself, MinuteClinic started to create an industry too. And you see, the collective knowledge for those of you that are here in Minnesota, but you're here for a reason. And I think you look at what the Valley's doing, they're throwing a lot of risk money at it, but they're doing it in a very silly way. And I think that Minnesota is uniquely poised to help really drive this convergence of healthcare delivery and technology. And I think that's just an inevitability. We have a ton of very progressive providers here, right? From Fairview to Health Partners to Allina to Ridgeview. There are people who are actively leading the market in this payment reform and in healthcare delivery right here, and they're investing in these companies, and they're taking an active interest in that. So I think when you look from an ecosystem, that provider space, obviously you can't ignore United, but you have the Blues here, which have a national influence too. And then sort of the collective knowledge that comes from a lot of the device. I mean, the device world is an upheaval, right? And that intellectual capital has to be applied somewhere else. And I don't see it going anywhere better than that convergence of sort of the technology and the service delivery. And what we're considering to be devices is also blurring. So I think Minnesota is very uniquely poised for that. For us, raising capital is hard, but if you have a good, compelling value proposition and you have a market with a really good, especially in this case where we can go and we can pilot early and often, I think it's pretty compelling, and you're seeing money come in. You look at what we've done, you look at what Bright Health just did. I mean, there's real money. One of the largest Series A's in a long time came here, and it's outside capital that's coming to Minnesota. Yeah.
So, of course, we always set that up. We like to really make sure everybody gets the Minnesota flavor, but John's not actually a homer, so one of the things that I'd like you to walk us all through, so you're from Lawrence, Kansas. You came up here to get a Bachelor of Arts at a small, wonderful liberal arts college, St. Olaf, in Russian. And now you're redefining the way healthcare looks. So how does that guy become this guy? And, for all of us that are making job descriptions and taking a look at what we think we really need, is there also an opportunity as things change to look perhaps at our talent pools differently?
Yeah. Well, obviously the bar is pretty low. So, I mean, consider yourself, right? It's, I don't know. That's a really tough question to ask. I mean, I feel really blessed I think part of it is that this has been a great community for me, and again, a lot of people who have taken an active interest in my career, and Zipnosis, again, as a company, I think is there. I think, so I was Russian language and computer science too, and so I think there is always sort of I have a little bit of that technology behind it, but ultimately I think, for me, being an entrepreneur isn't about do you have the qualities, it's really about do you want to be the pioneer, do you want to pick up the machete and start walking and hacking and be okay with that. And I think that more than anything, it's that, ideals to action, take the step and be that. I don't think there's anything innate within me. I have my own skill set, For me, I know what I do well is see that vision, articulate it, and inspire people around it. And I'm not probably a CEO of a publicly traded company, right? I mean, that's just not my jam. But there is my role here. And I think for each of you guys to also understand your role in that. And, Maybe you're a really good number 2, and you find the number, the guy who's kind of the John, and you want to be a part of that. But I don't think there's any sort of prescription for it. And I know for me, it's a little bit of, you lose a little hair and you get some scars along the way, but I don't think there's anything special about it. And so, yeah. And it's luck, too. There's some luck involved along the way. So, yeah.
So, as we kind of wind down, one of the things you've continued to talk about, looking out, seeing the future, having a vision. So, for the folks in the room who are looking to, make some bets about where things are going, how do you see the next few years playing out in terms of how your model has an impact on healthcare, where you think there are opportunities or not, and where do you see Zipnosis in terms of growth and future, again, over the next few years?
Okay, so we only have a couple hours left, right? No, so I'll start high level. So I think what we do at Zipnosis really well is we provide access for patients and efficiency for providers. And those are two really important axes, especially as we move into value-based care. And so we're going to continue to innovate and define around that. And so I think what we're going to do is continue to push the boundaries of what you consider access points for healthcare. So it's not just the smartphone, but it might be a myriad of devices or text messages or other ways in which you're interacting, and it's coming through the Zipnosis platform. And we're starting to use, again, really smart systems, clinical guidelines, and integrated data to make that access really smart. Because sometimes you don't need to come in, but sometimes you might need to talk to a doctor on the phone, but sometimes you might need to be referred to a specialist. And so you're going to see the system and the platform sort of evolve along with the ecosystem. And then on the back end, on the provider side, I think there's tremendous amount of efficiency that can be brought from this just by changing some of the documentation and workflow burdens that have been put on clinicians through Epic, et cetera, et cetera. And we're using those smart tools and clinical decision support organically built into it to make their lives a little bit easier. And so those are some of the two axes. What I'm really excited about, so if we paint a picture, if we're successful, what we do at Zipnosis is we go and we put in our platform across every health system in the country. And we've given you guys, us as patients, the most convenient healthcare access you've ever imagined. And we're driving efficiency on the back end, and it's all along one big digital pipe, right? And now you start to think about that at scale. It's not just sinus infections, but now you're screening for hypertension and hyperlipidemia, and you're doing CPAP studies, and there's a whole continuum of care that can then sort of be bolted into that. And that's a very, very different value proposition than thinking of this as sort of a transaction-based model. So I think over time, what we want to do is actually drive the transaction cost to zero and really look at how we use that access and efficiency and that digital connection to think about managing population in a very, very efficient way. And so the devices that get plugged into that, the AI that gets plugged into that is all going to be a part of the larger, I think, Zipnosis experience in the years to come.
Well, you made the comment that there's nothing special about this, and I think everybody in the room would say that you're wrong. So for our audience, what I'd like to say is if you don't know Jon Pearce, you should, and if you don't know Zipnosis, you should. Jon, it's been an honor to bring you on here to be able to chat a little bit, give people a little more insight into what you're doing, and I would give you the opportunity for the parting shot.
Well, I thank you, and please do connect with me, or I'd love to hear stories. But I do feel for me, it's a great honor to be up here and have an opportunity to share the story. So thanks. Yeah.